Good morning, good afternoon. Welcome to our Voices of Value podcast on LinkedIn Live, the next edition. I'm delighted to welcome my colleague and our AVP of Clinical Development, Danielle Bergman, to this podcast. Danielle commenced her career as a critical care registered nurse at Florida Health, and then transitioned to healthcare informatics to become a senior director of clinical development at JVON, which was acquired by Lightbeam Health a few years back and has since then been promoted to AVP of clinical product management. Danielle loves engaging with our customers and is a treasure trove of really valuable insights and best practices on population health management and value-based care. Danielle, welcome to the Voices of Value podcast on LinkedIn Live. How are you feeling today?
I am doing great. Thank you, Andy.
Awesome. So without further ado, let's get started. So Lightbeam has been a pioneer in prescriptive analytics, moving beyond predictive insights to actionable recommendations that prevent avoidable events and improve outcomes for our customers. From your perspective, how do you define AI and in healthcare today, and how does Lightbeam's AI fit into that definition?
Yeah, great questions. I think there's subjectivity when we talk about what is the definition of AI in healthcare, but to me, I think it's about turning data into direction.
Mhm.
And so what I mean is we don't have a data problem in healthcare. We actually have
Do not.
mostly a connection problem.
Yeah.
We're surrounded by data like EMRs, claims, labs, you name it. There's multiple aspects of data, but they all kind of sit in silos for healthcare organizations. And usually in traditional healthcare, we're seeing that they're only getting that information after the fact. So we know the challenge isn't really collecting data anymore. We've gotten really good in the industry of collecting, looking data, and connecting us in a way that, helps us understand what has happened. But the direction is how do we use the data to connect in a way that makes it more timely and more where we can make meaningful decisions as clinicians and as providers. As I mentioned, most of it is retrospective. So we're looking historical, what happened for our organization. But when we talk about AI, that's when it's designed well, it allows us to shift from that reactive to what did we do wrong or what happened wrong poorly, to more of a proactive approach. As a provider and clinician, we want to see what's coming next, what's down the path before my patient ends up in the hospital emergency department or becomes, our quote unquote high user. And so when we talk about Lightbeam AI, that's the prescriptive analytic, and that's where that comes into play. Traditional AI is predictive analytic, where it tells you who's at risk and it ends there, it stops there. Where prescriptive AI tells you, why is somebody at risk? What can I do about it? And that's the key, is connecting data to informing clinical decision making. Because at the end of the day, if we're just flagging a patient for a readmission risk, it stops there. It ends there, and it's up to the care team to make that decision. But if we identify somebody at risk, prescriptive AI takes it a little further with saying, well, why are they at risk? What's driving that? Is it medication adherence? Is it lack of transportation? Is it social isolation? And then what do I do about it? Do I need to do a medication reconciliation? Do I need a home visit? And I think that this type of intelligence is extraordinarily powerful, especially for our value-based care contracts, because they're really focused on improving quality outcomes, using resources more efficiently. Prescriptive AI allows us to focus on those impactable patients,
Mhm.
not just high risk, but also who's going to respond to my intervention. Organizations across the board, across the nation, we know everyone's spread really thin. Statistically, we know resources are scarce. And I think that's where prescriptive AI aligns with that beautifully, with that value-based care model, focusing on outcomes, cost, personalized care. And that's truly what the goal of Lightbeam AI prescriptive AI is intended to do. By identifying who's at risk, what's driving them clinically, socioeconomically, And then what do we need to do? What's informing my clinical decision making so that I can move the needle? From there, you can take it a step further, and we could, talk about that in a further topic, is potentially automating it further. Like
Mhm.
the next
Mhm.
step is changing, the next step is, all right, now we have this great information, but how do we take it a step further? I do want to call out, I think if any clinicians are listening to this podcast, one of the things is like, we're not replacing the human aspect of healthcare. It's actually the opposite. The goal of AI is to do more with less. So we're not spending time digging through data. We're spending more time, connecting with patients, helping them improve their outcomes, and ultimately, helping clinicians get back to the purpose of why they came into healthcare, which is to help patients in the first place, by making, time and resources more efficient. Sorry, that was a loaded response, but hopefully you got
No,
it.
love that. I'm actually writing this my next post on a 5-stage life cycle for agentic AI, and it's very interesting how you flowed that through, right? From actionable insights, right, with prescriptive recommendations,
Mhm.
prescriptive actioning, to automation, right, or
Right.
to clinical decision support, to AI automation or AI automation, which is kind of the holy grail. And from a value-based perspective, again, clinicians are burdened, and improving their productivity, easing some of that burden, right, with the clinical decision support, to as well engaging with patients, right, and leveraging the data, making them aware proactively, looking at the ones who will respond to the interventions
Mhm.
versus ones that won't respond, or they're multi-morbid enough conditions that ensure that they're perhaps candidates less likely to respond. I think is incredible, right? When there are such constrained resources. So thank you for that, for those valuable insights. Let's move to the next question. So Lightbeam's models have always focused on transparency, right, or what is being referred to as explainable AI, showing
Mhm.
why a patient is at risk, what actions can mitigate that risk. So, given this focus on explainability and clinically interpretable AI, which is kind of the holy grail, do you think we have reached a tipping point in clinical trust and adoption of AI driven insights in healthcare? Because that was always a challenge, right? The black
Mhm.
box notion. I remember participating in panel discussions, and one of the biggest inhibitors, especially from CMIO, CHIOs, was the fact that it was black box. So going from that black box to clinically explainable, is that a tipping point?
Yes, yes. So I think we're definitely we're seeing more willingness to use AI. I think, now as clinicians are seeing that it can make their jobs easier, it can make it more effective. But I will say that adoption is still a journey. And one thing I've learned throughout the years, and it's not about just trusting the accuracy of the model, it's also the clinician's comfort with new kind of data. So, as a clinician and provider, like we're trained to interpret vitals, labs, imaging, the whole gamut, but we're not classically trained to interpret AI-driven insights, and we're not classically trained on socioeconomic determinants of health and how that impacts health outcomes. And that's really a big shift. And so what I've seen over the years is when AI starts to surface new information, like this patient likely has food insecurity or transportation risk, it requires that clinician to say, okay, I need to incorporate this into my care planning, but this isn't how I'm classically trained. And even when models are explainable, where the drivers are clearly listed, there's still a learning curve to be had. And what I've seen, in the last 7 years in this industry is that we're seeing more openness. But I will say there's still a cognitive burden, like still a learning curve as they're adjusting to that new way of thinking. I'm not seeing as much. It's not about technology like resistance. It's more about the translation. So a clinician helping clinicians understand, how do I apply this to the AI outputs to my patient care? And that's truly where, we have put a lot of focus on striving to make AI insights as seamless as possible. And that can be within an existing clinical workflow. Some organizations that's in their system, their existing EMR, and others it's within a portal. So it's all about improving accessibility and alignment. I believe that in order for AI to be adopted, it does have to fit in the day-to-day as best as it can. That's with air quotes, as best as possible. But that's the other key component of like this tipping point and willingness is, clinical education support. And again, it's not about, because explainability isn't about just showing data. It's about making it meaningful. So the clinic and digestible, it needs to be digestible for them to apply it and to implement it in their day-to-day practice. So the summary is, yes, I think we're at a big tipping point in willingness. But I think the next phase, if we're talking about clinical adoption with AI, is fluency, helping clinicians feel confident in interpreting the insights, but also applying them into practice to where we have true adoption, really.
Yeah, it's what you mentioned is very, very interesting. I'm something of a anthropologist of technology, if you will, a tech anthropologist. And I remember over the last 20 years, as we looked at technology adoption, healthcare life sciences have always been laggards, right? Because we have to be in the business of saving lives. What is incredibly surprising, which actually blew me away, is with AI, healthcare is somewhat at the forefront of that adoption, especially with technologies like ambient listening, which, as you can imagine, has seen widespread adoption with physicians. And in fact, now with recent announcements from the likes of our partner, Microsoft and Nabla, some of the earliest, ambient listening vendors, they are now extending that to nurses, which is going to drive that adoption even further. So I really didn't think I'd see the day when healthcare actually is leading with technology adoption. But I think some of the value that technologies like ambient listening is enabling for physicians and nurses from that productivity, lowering fatigue and burnout is exactly driving that adoption that you just spoke about. We live in fascinating times. Going to the next question I have for you. So I know you work extremely closely with customers. So when you engage with health systems and ACOs, what are you hearing about their readiness and interest in adopting prescriptive AI solutions similar to the ones we offer and you just spoke about? So how are care managers, clinicians, and executives responding to the idea of embedding AI directly into their direct workflows, which is a great flow through from the previous conversation?
Yeah, and I will say it's continued to grow because, as we spoke to earlier, like we know that resources are scarce. We know there's a shortage in providers and nursing staff. So under those organizations that are under these value-based care contracts, they know that reactive care is too expensive anymore, both in dollars and in the human effort, right? So that's where we see that growth of we need something to help us be proactive based on our limited time, limited resources. Where can we have the greatest impact to drive this type of care model? I think if I were to summarize, like the most common feedback is we need it to be simple, we need it to be actionable, and we need it to align with how we already work day to day. So that's back putting it into a workflow. The key to success, I will say, of all the clients and folks I've interacted is really like focusing on clinical workflow. Because clinicians, as working in the field myself, like we don't have time to sit through data points day to day. We need something clear, interpretable, and I need to know where to help or which patients need their most help, who needs my attention, why, and what to do next. So I think across healthcare, we're finally seeing, AI move from this buzzword to something that's truly practical in day-to-day clinical workflow. And that's something that care teams, can use to prioritize patients, guide outreach, support population health, and care coordination. And I think if we're talking about accessibility, going back to like, it doesn't always have to be in the existing system, but it needs to be in a manner that feels seamless to the clinician when using it. So whether that be in a portal view, either way, the goal is the same, that we want to make insights easy to find, easy to interpret, but easy to act on, that they know very well, like, this is what I need to do next. And I think when AI gives clear direction without adding unnecessary complexity, that's when it starts to feel less like another tool, another technology, and more like a natural part of their day to day.
Absolutely. And it so resonates with me. And in fact, like to relate this anecdote, we were at HIMSS 2025, right? And we had this standalone ambient listening apps, right? Suki, Nabla, Abridge, Ambience that the world hadn't heard of. And very interesting, I got into a conversation with one of our friends from class research, and I kind of predicted, put on my visionary hat and predicted that all of these standalone ambient listening apps will intrinsically become a part of clinical workflows. And lo and behold, we are seeing that happen in front of our eyes, right? Microsoft's Dragon Copilot, becoming part of Epic's workflows. We are embedding ambient listening within our care management workflows, as you've just mentioned, which is indeed very exciting. So we literally, it's the future happening right in front of our eyes. Moving to our next question, our AI solutions have demonstrated significant value. Obviously, we are in the value-based care business, and value and ROI and payback is significant for clients. So from avoidable admission reduction to improved care coordination and population health outcomes, we have obviously a bunch of customers who have seen and shared those examples with us. So can you share a few examples of this impact, especially with St. Peter's University Hospital? You did a recent webinar with them, which triggered happily like 12 articles across the nation. And what does that success tell us about the real world ROI of prescriptive AI that we've just talked about?
Right. So this is the point where we say, like, where does this all come to life? What does this look like?
Exactly.
I think St. Peter's is a great example. So for those that don't know, they're I believe around a 400-bed safety net hospital. They serve a really diverse, low resource population, like many other organizations. They also know that their socioeconomic determinants of health drive a huge part of their outcomes. So they have a population that, is facing food insecurity, transportation barriers, language barriers, and housing instability. So they already had great community programs in place, but their challenge was knowing who to prioritize and when. And so working with them, where they implemented Lightbeam's prescriptive AI. They use clinical, behavioral, and those socioeconomic data. The model helped them understand who within their community is going to end up in the ER in the next 90 days. And it wasn't just those obvious high-risk patients, but those rising risk patients. And once they had that insight, that's where their staff focused on who is impactful. They were able to connect patients to food and transportation programs. They were addressing barriers that were showing up, in real time. They did see a 7.1% absolute reduction in ER visits compared to a matched control group. So that's big on outcomes and costs right there for the organization. But I think what's equally important is that how it changed how those teams worked, how they interpreted data, how they learned to let AI inform their clinical decision making so that they can have that bigger impact. And that's the beauty of this outcome, is like the cost, the efficiency change. It's not about replacing clinicians. It's about like amplifying them, right? Like it's about giving them the extra oomph that they need to do their job to the fullest extent, helping them focus their energy where it matters most. I speak to our clients and other accounts that it's not just ROI is not just financial today. It's operational and it's human. We have to look at ROI from the human aspect and the resource aspect. I think one of the care team members in St. Peter's, mentioned in the case study that we talked about that there was several patients that they would have missed without the technology. And I think just that quote in itself of like, I would have missed that patient if I didn't have this extra insight. And that's really what impact looks like. That's the true ROI, is the impact of the patient, those hidden patients, and then the cost drivers that subsequently come out of that.
Thank you. Thank you for that Cliff Notes version, which
Yeah,
is
short and
still
sweet.
very exciting. For those of you in the audience, if you are intrigued by, Danielle's Danielle, the raconteurs version of the St. Peter's Healthcare case study. We'll put a link to the webinar, which featured Danielle and Ishani Vaid, the Director of Population Health from St. Peter's University Hospital, and strongly encourage you to check it out if you're interested. So looking ahead, what key capabilities or innovations do you think will make prescriptive AI more usable, more consumable, more adoptable for clinicians, nurses, and care teams in value-based care organizations such as the ones that we serve and work with?
Right. So I think the next big wave of like usability and adoption is not making the models more complicated.
Of
It's about
course.
making them easier to use, right? The goal is that we know in trajectory of resources across the United States. We know that we have scarce resources today, and it's going to continue to be more scarce. So as the population gets more sick, and our clinician staffing shortage decline, like there's a kind of a perfect storm there, and that's really where we need AI to take more things off the clinician's plate. We know that healthcare, we're running on information overload. So clinicians don't need more dashboards. They don't need more data points. They almost need context and confidence, I would say. Like the future comes down to like, is it usable? Can I interpret it well? And does it work in my day-to-day job? Where organizations are having the most success are the ones that are making AI feel a part of the day-to-day. They're meeting, users where they're at, whether that's in the EMR, a care management platform, or like a point of care tool. They're surfacing information, not that's meaningful, not these algorithms. And I think the next layer, as we're alluding to, is that automation, right? Taking the
Exactly.
work off of their plate. The more we take off, the more, adoption is going to skyrocket because, as I mentioned, as we know, those shortages continue to increase in healthcare teams. The real opportunity is to reduce the cognitive burden. And I think that's where prescriptive analytics plays a big role. It helps teams, understand the why and what to do about it. And the next step from there is what can we do to close the loop? So connecting the prediction directly to outreach and action. So that's automating, the first layer of patient contact. So use AI to trigger text messaging or phone calls to screen patients with questions, identify barriers, confirm recent events. And that's something we're already doing. We're already connecting Lightbeam AI to SMS text messaging and automated phone calls. And I believe that's going to transform the way that, care teams triage their workflow. Instead of, if I'm a care manager, instead of calling 100 patients, I just need to call the 10 who actually need help that responded to our messaging system with an unmet need. And that's the key. So organizations, I think, will really win, those that focus on adoption and design, not just model accuracy. I've said this for years, like even you could have the best model, but if it doesn't fit into the day-to-day life of the clinician, doesn't make their life easier, it's not going to be adopted. So I think it's taking, instead of having complexity, it's turning complexity into clarity, and making technology feel like a natural extension or like of a care plan of my, a natural extension as my duty as a care provider for the day to day.
Could not agree more. Again, reminds me of two truisms, right? As a tech anthropologist, the first is adoption happens when the technology becomes invisible, right? It becomes an enabler. It becomes part of the workflow. It's intuitive, and an extension to that is again heard from one of these leaders who drove AI adoption at Kaiser Permanente, which I think probably has the highest adoption of ambient listening today. And she mentioned that what we've learned from our lessons from the past is not pushing technology out to our clinicians. In the case of ambient listening, it was literally a few early adopters, and then viral adoption and pull from clinicians and nurses, which really saw success with adoption with that. I think they started with, 3 months ago, it was 22,000 physicians across Kaiser Permanente, using ambient listening.
Wow.
And now hopefully that's extending to nurses. I think it's the largest deployment of ambient listening in the world. So your words, so resonate, right, on that.
Mm-hmm.
So concluding question on a more, personal note,
Yeah.
how do you incorporate AI into your work or daily life? And as obviously an ABP of clinical management, also a wife and a mother, and what do you see as the biggest benefits of using AI tools to enhance efficiency, creativity, or balance your day-to-day responsibilities, both personal and professional?
Yeah. So, I mean, I definitely use it, probably the same way a lot of folks are using it. So professionally, it's beautiful in summarizing complex topics, simplifying information. It'll tailor it to, reading level and different audiences for you. Prepping for presentations, it can help with workflow, or even writing, translating language to clinicians, to executives. It really helps think, faster and clearer. I think of it as like, it's like my efficiency tool.
Mhm.
I don't use it, if I'm putting my provider hat on, and like, it's never a replacement, because it's how can it help write my provider notes or SOAP notes? Things that used to take hours after a day of work in a clinic, now we have these automated tools that we just need to ensure accuracy and clarity was interpreted appropriately. And personally, as a mom with two under two, we can use it a lot to really like efficiency. Again, I've even asked it to do schedules for our household, and it's a beautiful thing when we have tools that make life simpler. I think, again, AI is about not replacing human aspect. It's like, how do we amplify ourselves to do better, do more? And not that we need to do more, but sometimes you just need a little help from a friend, and that happens to be AI. And so I think the biggest gift it gives us is time to focus on the impact work professionally, time to connect, with your families, or time to just take a breath if you're using it personally. I think that's what good AI should do, whether you're using it in your professional or personal life. It should create space for us as humans to do what we do best.
Absolutely. Again, reminded of an anecdote which has stayed with me that I heard at the last, class conference. Obviously, this conversation around how AI is impacting clinicians and physicians. The big thing, the big value proposition is it has now lowered my pajama time, right? I have more time for my family
Yeah.
versus doing the documentation. So thank you for sharing, those anecdotes as well as
Yeah.
how you use it in personal life. Danielle, such a wonderful conversation. Amazing insights. Thank you for your time today. And to everyone in the audience, thank you for making the time to hear from the brilliant and amazing Danielle Bergman. Hopefully, you've taken away a piece of insight or two that'll help inform your AI strategy, planning, and execution. So do join us again for the next edition of Voices of Value, exactly a month from today. Do subscribe to our Voices of Value newsletter on LinkedIn. Check out our blog, which is called the Beacon blog on the Lightbeam website, and do sign up. Do join us on LinkedIn and follow us if you have not already done so. Thank you very much for your time today, Danielle. Thanks once again.
You're
Love that
welcome.
conversation and looking forward to many more.
You got it.